The Inter-Religious Council of Kenya, in collaboration with the United Nations Children's Fund, Unicef, is implementing F4V vaccine, back to school, ESIR and better healthcare project. The project seeks to enhance access to and uptake of COVID-19 vaccination services in Kenya, strengthen child protection systems, improve sexual and gender-based violence prevention and response practices, and enrollment of out-of-school children back to school.
The target by the Ministry of Health to have 10 million people vaccinated by end of this year has received a shot in the arm, and it appears that target could become a reality if the campaign launched by Inter-Religious Council goes as planned.
Places of worship countrywide will be adopted and used for COVID-19 vaccination centers by the Ministry of Health for the next 3 months.
The COVID-19 vaccination awareness campaign by religious leaders, dubbed Imani na Chanjo ya COVID-19, will get to supplement the national accelerated vaccination drive.
We know that there are more than 180 vaccination centers already set up in churches, mosques and temples in a large number of counties, and there will be more to come.
IRCK, in collaboration with the United Nations Children's Fund and in partnership with the Ministry of Health, conducted COVID-19 vaccination drives to scale up the uptake of the COVID-19 vaccine in 21 counties.
Hawa ambao tunafanya mobilization, tunaenda kwa buying centers, wakati watu wanapima chai yao, tunangojea pale, tunawaambia umuhimu wa kupokea chanjo na watu wameweza kurespond positively, and I'm grateful for that. Tumeenda hata masokoni, tumezunguka masokoni. Timu ya Interfaith pamoja na MOH juzi wamekuwa katika soko la Miruka Market.
Tulielimisha watu kwenda kusaidiwa kudungwa mambo ya COVID. Tulitembea kwa makanisa, watu wakakubali, wakachukua kudungwa sindano ya COVID.
Tunataka kufikia kila mmoja, hakuna yule tunataka kumwacha nje. Tumeweza kwenda Miruka Market, tumeweza kwenda Kebirigo Market, tumeweza kwenda Ikonge Market, tumekuwa Kemera, tumekuwa Magombo, tumekuwa kule chini Mosobeti, na tunataka kufikia sehemu zaidi.
I thank God so much for IRCK for giving us this platform to actually understand what the vaccination was all about and the teachings we got, whereby they sent health workers to come and train us, teach us fast at hand, to understand what the COVID-19 is and why the vaccination should be there and how many doses one is supposed to get.
Ninashukuru kwa sababu ya kuhusishwa katika kufanya campaign ya COVID-19 vaccination, na niliweza kufanya mobilization, nikafanya mkutano mara 2 kwangu kanisani, nikazungumza na washirika wangu umuhimu wa kupata chanjo ya COVID-19, na pia nikaweza kutoka nje na kuongea na community na kuwatangazia kwamba kwangu kanisani kuna chanjo ya COVID-19, kama mjachanjwa mje kanisani, na watu wengi sana wakaweza kurespond. Sababu ninakumbuka siku ya kwanza tulipata kuchanja watu 35 na siku ya pili tukaweza kuchanja watu 27. Na kazi hiyo tulifanya katika collaboration na IRCK, Inter-Religious Council of Kenya, pia na Ministry of Health na Unicef.
Baada ya kuona kwamba wizara imetambua kwamba viongozi wa dini wana mchango mkubwa ili kuhamasisha watu, wakatushirikisha na tukazungumza na wale ambao ni waumini wetu katika misikiti. Alhamdulillah, watu wengi wakajitokeza ambao walikuwa wakiona wakisema wengine kwa kidungwa wasikia uchungu, mkono wa kufaganzi, lakini wakadungwa. Nikapata katika msikiti wangu karibu mara moja tukafanya, baada ya kuzungumza tukapata takriban watu karibu 30 wakaweza kujitolea, na wengine wakataka tena kuchanjwa, lakini nikawaelekeza katika facility na wakaenda wakapata chanjo kama hizi. Kwa hiyo namshukuru kwanza Mwenyezi Mungu Subhanahu wa Ta'ala, na kushukuru shirika la IRCK kuweza kuwafikiria viongozi wa dini kuwapa elimu kama hii, wakishirikiana na Wizara ya Afya na pia Unicef ambao walijitolea ili kuweza kuokoa maisha ya wanadamu ambao walikuwa wanaangamia kwa njia ambao kwamba hawaelewi.
We had a very good discussion on this particular topic within community as well as Inter-Religious Council of Kenya. We were always having trust and confidence on our engineers, scientists, doctors. I'm very proud to say that the community, Hindu community, really supported this drive since this starting across the country.
And we are still working together in collaboration with the IRCK and the Unicef to make sure that we meet the target which is required as per the HWO.
Religious leaders through IRCK in consultation with National Parents Association, County Director of Education, and County Interfaith Networks utilized religious leaders' trust and capability to mobilize out-of-school children in their counties to go back to school.
Mwakani tumeweza kuwa na activities ambapo tulikuwa na mchakato wa kuhakikisha tunatia msisitizo katika initiative ya back to school. Na sisi kama washirika wa Mombasa Youth Interfaith tuliweza kuplay a very big role, na sisi vile vile tulikuwa mstari wa mbele kuhakikisha kwamba Mombasa inaonekana ya kwamba vijana wana support mambo na elimu.
Lile kubwa ambalo tulifanya kama Women of Faith, mimi ni member wa Women of Faith, tuliweza kuungana kama viongozi wa Kwale County na tukashirikiana departmenti zote, religious leaders, viongozi wa administrator, machifu na village elders, tukaweza kuelimisha jamii yetu mambo ya back to school.
Religious leaders through media advocacy have been able to create awareness and reach to a wider population.
As religious leaders, we understand the importance of setting a good example and sharing accurate information. This is another opportunity for us to lead the way by getting the COVID-19 vaccination and showing that they are safe and effective for the vast majority of people.
Vaccines are the only safe way to protect yourself, your family, and the congregation. Let us pray and act together so that we don't continue to lose Kenyans' lives to this COVID-19.
My name is Pastor Samuel Makori, the leader of the Seventh-day Adventist in Kenya. The more of us are vaccinated, the more lives are saved. And our schools, our churches, our economies, our counties, our markets will remain open.
School closure has interrupted learning for over 17 million students who have missed months of formal education. The longer students are out of school, the greater the risk that the poorest among them will never return. To parents, take your children back to school as soon as their classes are open, for this is to the best of their interests.
The children are safer in school than out there. And you all can attest, you all know what has happened so far. We don't want that to continue. So I'm calling and appealing to all my church members and the Kenyans at large that we take our children back to school come January. They are safer there. The teachers take good care of our children. They protect them from all this violence that our children are experiencing right now. Early marriages, sexual violence, emotional violence, it is bad. So let's have our children back in school. They are safer in school than anywhere else.
It is important to consider the prolonged effects of the school closure on our children. I take this moment to request all parents to consider taking back their children to school when they reopen.
UNICEF Social Policy Department, the National Treasury, and the State Department for Planning rolled out electronic social intelligence reporting (ESIR) under the Social Budgeting Initiative. With support from Unicef, IRCK conducted ESIR in education, water, and health facilities to evaluate their current situation and make recommendations on areas for improvement. Previously, IRCK has supported county social budgeting observatories to implement components of SIR in their counties, which highlighted gaps in service delivery and action required by various offices taken up and addressed.
We are very grateful for the IRCK for the good work they have done. We have a reduction in child labor. We have reduction in gender-based violence. So we want to thank the IRCK, we want to thank the Unicef, we want to thank all the organizations for the good work they have done.
The Interreligious Council of Kenya continues to collaborate with strategic partners to enhance access to and uptake of the COVID-19 vaccination services, strengthen child protection systems, and enrollment of out-of-school children back to school, both at the national and the county levels.